Welcome back to The Gist. Recently, we've been examining the writings of Jon Kabat-Zinn on the power of our senses and how they keep us grounded in the present moment. But it's easy for us to think of our senses, and in fact our whole body, as disconnected from our minds. John often refers to a funny quote from James Joyce's book, The Dubliners, where one of the characters, Mr. Duffy, is described as living, quote, a short distance from his body. While funny, this statement isn't too far from the truth for most of us. We think of our minds as the command center of our lives, with our bodies tagging along. But what if we could have a more integrated sense of self? Psychiatrist and author Jud Brewer uses this notion of an integrated self in his own practice. He encourages patients to let the body lead us back to our minds, to help us break through unhealthy behaviors and mental habits. He has worked extensively with people who have addictions of various kinds. He combines therapy with mindfulness by inviting patients to put their attention on their bodies when they feel addictive urges. Judd gives the example of a patient who had a food addiction and would indulge in emotional eating. By asking her to eat more slowly and mindfully the next time she opened a bag of chips, his patient was better able to engage her senses. Remarkably, she noticed that after the first few chips, her craving had started subsiding. She didn't even really want to eat anymore, but usually did so habitually to feed her negative emotions until the bag of chips was empty. The chips, of course, were a distraction from having to deal with underlying difficult feelings. So, by helping patients see the link between their bodies and their behaviors, Brewer's been able to successfully change addictive patterns. If his patients can address the root cause of their negative habits, they can slowly learn healthier ones. Brewer has also extended his approach to anxiety, which he sees essentially as an addiction, just one that's not linked to a physical substance. It's more a mental addiction, an unhealthy set of thought patterns that we engage in reflexively. Judd once again invites his patients to pay attention to what is happening in their bodies. Where in the body do they feel the anxiety most acutely? Perhaps as tightness in the chest, or a knot in the stomach, or a racing heartbeat. By addressing these physical symptoms, patients can begin to slow down their anxious thoughts and create some emotional distance from them. With this distance comes a sense of awareness, which allows patients to apply some critical thinking and make a connection between what triggered their anxiety and what behavior ensued. Once this understanding has been established, they can work constructively with Brewer to choose a different response the next time, what he calls the BBO, the bigger, better option. By approaching their anxiety with curiosity and kindness, patients realize that they can get through the discomfort of an anxious feeling and make it through to the other side. Rather than giving into a spiral of anxious thoughts, they can instead choose to engage in deep breathing, or self-care, or go for a walk. Over time, the BBO starts to become their new habitual response to old triggers, and hopefully their overall level of anxiety subsides. If you want to learn more about Jud Brewer's work and his methods, you can pick up one of his books, including The Craving Mind on Addiction and Unwinding Anxiety. So this week, if you find yourself engaging in some habitual behaviors like addictive eating or reaching for another substance for comfort, or if you're getting stuck in common thought patterns like ruminating about the past or obsessively worrying about the future, try Judd's approach. Slow down, engage your senses, and bring attention into your body. Bring curiosity and kindness to what's happening internally, and notice any underlying restlessness or discomfort. And consider what your BBO is to replace your usual knee-jerk response. By doing so, we can approach life as a more integrated self, grounded in the realization that we are whole and can solve problems in healthy ways, that we are stronger than we think and can handle and resolve difficult emotions by sitting with them rather than distracting ourselves from them. So, wishing you a great week ahead exploring the idea of an integrated self. Next week, we extend this idea to look at various types of physical, mental, and social integration through the work of Dr. Dan Siegel. See you then.